Hello, everyone. Dr. Yonit Arthur here. You are on the Steady Coach. And in today's unedited video, as part of the Ask Dr. Yo series, we're going to be addressing the fascinating topic of vestibular testing and when to have it. I know it's very exciting for me, maybe not as much for you, but it is important because it's something I get asked about a lot on my channel, primarily in the form of these two questions. Number one, what testing should I have done? And number two, but do I really need to have that testing done? So we're going to address both of these today, but I want to share a little bit more about my biases first. Number one, I'm an audiologist, which means I invested a bazillion dollars and hours into learning how to test people. This means A, I'm the kind of person who likes testing, and B, I'm invested in testing. So I like tests. I like that we get definitive answers from things, and that's going to affect my answer today. But number two, I've been working almost exclusively with people who are dealing with medically unexplained dizziness symptoms over the last 4 or 5 years. I've come to understand and realize that over testing, or really just extensive testing that's not really needed, has consequences and harms. And I don't think that healthcare providers are conscientious enough about this. So I think we need to talk about it so you can make a good decision for yourself. By the end of this video, you're not going to get a definitive yes or no answer from me, but I'm hoping to arm you with enough information that you can make a good decision for yourself about whether you should have further testing or not. All right, so as far as what kind of testing you should have, I know you did not come to my channel to hear me say this, but I have to say it anyway because it's the truth. Dizziness is a very non-specific symptom. The only person who can tell you what types of tests you should have is your medical provider. Now, I'm aware many of you have seen 35 doctors and had a bazillion medical tests. So for you, you can skip the next couple minutes and move on to question number two. But for those of you who are relatively new to symptoms, it is really important that we get big bad things or medically caused things ruled out, either so we are honest about what's really going on and you don't treat something as a neural circuit problem when it isn't, or so you can get medical treatment or surgical treatment if that's what you need. So we really need to make sure those things are covered. And the only person who can tell you whether they're covered or not for you based on your medical history is your medical provider. That all being said, if it were me, I would definitely want dizziness-specific testing and a dizziness-specific doctor. This is my bias speaking, but I would want to see a neuro-otologist if at all possible. Neuro-otologists are physicians who specialize in diagnosing dizziness and related disorders. They are the best equipped to really get a whole picture of what's going on and then help you make decisions about what tests might be really important and what tests might not be. There are so many tests that can be done to help diagnose dizziness, and it is almost for certain that you do not need all of them. A neuro-otologist is going to be able to tell you which ones you need and which ones you don't. Now, I am very aware that you, my lovely viewers of my channel, many of you live in locations where you don't have access to a neuro-otologist, and it may not be financially available to you either. So my suggestion here is, if you've gone through medical testing and you haven't yet seen a specialist like a neurologist or an ear, nose, and throat physician, that would be a really good idea. Again, we're just doing as much as we can to rule out medical problems that are easily treatable. And there are some in-office clinical tests that can be done to help us figure out if there is a sign that there might have been a physical problem that set off your dizziness symptoms in the first place. And those things are important for us to know because they may affect the course of your treatment, which brings me to question number two. I think this is really important. When answering the question of, do I really need these tests done? The primary question we should be asking ourselves is this testing going to change the course of how I'm going to address these symptoms? If the answer is no, then we should not be doing further testing. If the answer is yes, then we should consider further testing. So first of all, I would love for all of you to watch the video that I created about how to handle doctor's visits, because I talk very much about that first point in that video. I will link to that in the video description below. And again, highly encourage you to watch that. Very, very important stuff. I tell you exactly how to talk to your doctor about getting medical clearance. But then at that point, if your doctor recommends further testing, we have a little bit of a decision tree. We have to make a decision about whether it's actually worthwhile or not. And this is my opinion, but I think that blanket recommendations for further testing are not good recommendations. I think that a lot of you probably don't need more testing than you've already had. Now, if you're new to dizziness, if your dizziness started within the last 6 months, then it is super nice to have vestibular testing done, because it does impact the course of treatment. It does tell us, hey, you need a very specific kind of vestibular therapy, and this is the expected timeline of recovery. Once we've gone beyond the 6-month mark, I'm not saying that it wouldn't help you to have testing, and I'll talk about when it might help you to have testing done, but it becomes much more questionable to me. And the reason it becomes more questionable to me is because I always see things through a biopsychosocial lens. Biopsychosocial lens means that I understand that symptoms are always a combination, they always involve our biology, our psychology, and our social context. And this isn't just me being like, woo, like, yay, psychology. This is me looking at things from more of a hard science perspective. Because in the last 10 or 20 years, there's been this field, psychoneuroimmunology, that has been developing a lot. And studies in this field have been showing us that our psychological well being and our social contexts affect our biology. So it's not just that, if you think you're not going to get better, it's just kind of in your head and you make up symptoms. It's that if you think you're not going to get better, it affects your nervous system on a physical level, and that this can actually impact your ability to recover. So when you're looking at something through a biopsychosocial lens, you might need to weigh the benefit of looking further down that biological path and seeing if there are more disease processes or tissue damage that might be causing a problem, and the potential harms that can be done to someone when you're constantly testing them, poking them, prodding them, when people have already been traumatized by goodness only knows how many medical tests, as well as the horrible dizziness symptoms that they're experiencing. And when the physicians and other medical providers that they're seeing are thinking about things through a purely biological lens and are therefore giving them dire messages and essentially noceboing people into symptoms. So you're all familiar with the placebo effect, I imagine. The placebo effect is when you think something's going to help you and it does. But it's not just because of your thoughts. The field of psychoneuroimmunology is showing us that the placebo effect has actual real physical correlates, meaning your beliefs affect the chemistry of your brain and the electrical activity of your brain. So placebos don't just make you think you're going to get better, they actually physically cause you to get better. The nocebo is the opposite of that. It's when you think you can't get better, and that physically alters the chemistry of your brain and the electrical activity in your brain, and that actually causes you to have less likelihood of recovery. I think when medical providers, as well-intentioned as they may be, are doing a lot of testing on you and constantly looking for problems, they are quite likely to give you messages like, yeah, you're going to have this for the rest of your life, or this is horribly wrong, this is damage that will never go away, or if there's nothing wrong with you, yeah, you have PPPD, it's a permanent condition, as we've talked about in some of my recent other YouTube shorts, the YouTube videos. So there are potential harms here, not to mention the hassle, discomfort, and cost of going through all this testing. So, should you go through testing? Well, I think you should ask yourself 2 questions. The first is the one we already asked. Will this change the course of my treatment? And that's a question that you can ask your doctor directly. If the answer is, yeah, this is really going to affect the course of your treatment, then it may be worth considering doing the testing. The second question is, will this actually make me feel better about my prognosis, or is this going to make me feel much worse? And be honest with yourself about which category you fall into, because, in my opinion, it has less to do with the outcome of the tests than it does with the kind of person that you are and how you tend to think. I have seen people go through testing and emerge feeling a huge sense of relief because either A, they know what's going on, or B, they know there's nothing going wrong and they can just embrace neural circuit dizziness. I have seen other people emerge from testing getting a diagnosis like, for example, unilateral weakness, which is not a lifelong dizziness diagnosis. It just means that your ear is weak and your brain needs to recalibrate. You don't necessarily end up with chronic symptoms, discussed in another video I will link to below. But they hear this and they just have this huge fear and anxiety response to it, and they're like, I'm broken and I'm damaged for life. And then their physicians are giving them messages inadvertently that kind of support that, and then they just go off down this dark catastrophizing hole. So that's option one. Or sometimes people go through testing, nothing's wrong, and then they feel helpless and hopeless, and either A, try to find more tests to try to figure out what's wrong, or B, they say, okay, there's nothing physically wrong with me, therefore I'm going to just have this for the rest of my life and I'm helpless against this. And then they end up just feeling even more despair than they would have if they just not done the testing. So again, I'm not saying that you fall into any of these categories. I just want you to be aware before you commit to further testing that you should consider these things before you do it. Again, if you're new to dizziness, I think the pros outweigh the cons and it's worth doing the testing. If you're less new to dizziness and the longer you've had dizziness, I think the more applicable this becomes. You really want to think about the messages you're going to be giving yourself if you do further testing and whether this is even going to impact how you address your symptoms at all. So lots of thoughts here for you. I know this, again, may be a bit of a controversial stance, but I'm trying to be as fair as I can here, keeping in mind my biases. I'm not telling you not to get testing. You absolutely, I support you. Get testing if you want to get testing, but be aware of the nocebo and be aware of the fact that if the testing really doesn't change how you're treating your symptoms, then it's unnecessary. So ask your doctor that point blank. That's my recommendation. All right, guys. So questions or comments about this one, drop them below. Looking forward to the discussion on this one. And as always, if you found this useful, you like my channel, please like this video, share, subscribe to my channel. These things help me reach more people. Thank you so much. Talk to you guys soon. Bye.